Hundreds of doctors in Hyderabad's main hospital for coronavirus patients on strike, just one of many protests by healthcare workers across India. A doctor here was attacked by relatives of a patient he had just declared dead.
Two rushed towards us and they just throw the chair and plastic chair. They threw the plastic chair at me and the chair was broken. It was hurt to my left hand and again I was trying to escape and he took a iron stool. Small stool, and again he threw it at me.
Doctors in Hyderabad want the government to enlist more hospitals to treat COVID-19 patients. Nurses in India's leading public hospital protested for 8 days in Delhi until the All India Institute of Medical Sciences promised to improve working conditions. There are nearly 300,000 cases and more than 8,000 deaths, along with a public health system that has faced years of cutbacks.
India's public healthcare system, which was in a terrible shape, is, its limitations, its constraints, its inadequacies have now been revealed for the whole world to see.
NITISH BHARDWAJ says his father isn't receiving proper treatment in hospital.
He was admitted here yesterday and a doctor came to check at that time. And since then, no doctor has come to check on him. My father is 60 years old and a heart patient. He has a severe cough and a fever.
His uncle died from the coronavirus at the same hospital this week.
We kept on walking from the morgue to the hospital and with great difficulty we got the body and did the funeral. He too was admitted here. There were no beds available in all of Delhi. We had to put in a huge effort to get him admitted here.
The worst-hit cities of Delhi and Mumbai are supposed to have some of the best healthcare infrastructure in the country, but reports of people being turned away from hospitals continue. And here in Delhi, there are discrepancies in the number of deaths. Municipal councils said they've buried twice the number of coronavirus patients than those being reported by the government this week. Delhi's chief minister says they're expecting more than 500,000 cases by the end of next month.
By the
31st of July, we will need 80,000 beds. This will be a huge challenge.
Delhi tried to restrict the territory's beds to its residents, but the central government has overruled that decision. India's Supreme Court says the situation facing patients is deplorable and asked the worst affected states to explain why people aren't receiving proper care. Elizabeth Puranam, Al Jazeera, New Delhi.